Welcome to Section 5 of Reproductive Embryology. In this section, we'll be discussing teratogens. Let's get started. Teratogens are agents that can cause abnormalities of the developing fetus, and the fetus is most susceptible during weeks 3 to 8 of pregnancy. And there are three basic mechanisms by which teratogens can cause abnormalities. They can induce cell death, they can alter the normal growth of tissues, or they can interfere with cellular differentiation. And the severity of the abnormality really depends on the amount, duration, and some genetic factors. In this lecture, we will cover teratogens on two different tables. This is the first table, and it will be the main focus of this lecture. This is the second table, which lists other teratogens you need to know about. However, each of the drugs you see here will be listed in detail with our pharmacology section as image mnemonics. And there we will discuss not only the teratogenic effects, but also the mechanism of action and all details about the medications you need to know for step 1. So spending an entire lecture just going over the teratogenic effects of each of these drugs would be redundant and not an effective use of your time. After all, you need to know so much more about each of these drugs. So it's best to learn them in the context of the drug as a whole. So going back to this table, just remember that this is your chance to learn about these substances because they won't be covered elsewhere, and it'll make sense why. After all, DES isn't used anymore, thalidomide isn't used anymore, and radiation will not be covered in pharmacology, and we also don't prescribe methyl mercury to people, which is organic mercury. So since these substances will not be covered elsewhere, you need to know them here. So let's start by talking about diethylstilbestrol, or DES. This medication isn't available in the United States anymore. It's teratogenic because it disrupts the Müllerian duct epithelium in utero. The role of the Müllerian duct is discussed in detail in section 11 of this chapter. What you need to know now is that the Müllerian duct gives rise to many female reproductive structures, so it can cause problems to female reproductive anatomy. For example, it can lead to vaginal clear cell adenocarcinoma. And this DES exposure can cause various reproductive tract abnormalities, including fertility. Now let's discuss thalidomide. This drug has decreased in use since it's so teratogenic. What happens is thalidomide will block vascular angiogenesis in the fetal limbs. This means that the developing limbs will not receive the blood and nutrition they require, and ultimately this results in stunted or malformed limbs. This image shows malformed feet in a patient who is exposed to thalidomide in utero, and you can see how deformed they are. Next, let's discuss radiation. In this instance, we're referring specifically to high doses of radiation, and this is an important point. Diagnostic radiation, such as X-rays, are not considered high-dose radiation. So, generally speaking, X-rays would not impact the fetus negatively. However, we know that high-dose radiation can be very detrimental to the fetus. Interestingly, we learn most of this information through studies done on Japanese people exposed to atomic radiation from World War II. In any case, what happens is ionizing radiation will disrupt the growth of neural tissue, as well as other tissues. While many things can happen as a result, the most common outcomes are intellectual disability and microcephaly. The last teratogen is methyl mercury, also called organic mercury. High doses of organic mercury can come from many types of fish, and that mercury is toxic to the developing brain. And the net result is cerebral palsy and developmental delay. Cerebral palsy is covered in the neurology chapter. Without going into excessive detail about cerebral palsy, just picture part of the motor cortex being damaged in the developing brain. This results in paralysis of various parts of the body. Now that we've covered this table, let's review with a quick question. A 2-year-old girl is unable to walk because she cannot lift her lower left limb. The girl's mother states the patient has never moved her left leg, even as an infant when getting her diaper changed. Both upper and lower limbs are otherwise normal appearing. Which teratogenic exposure is more likely to cause this presentation? Thalidomide or organic mercury? Hopefully you notice this 2-year-old girl has paralysis of her left lower limb. And it appears that it's a congenital issue since the girl was never able to move this limb. And this presentation is consistent with cerebral palsy. So of the two options, thalidomide or organic mercury, which one is likely to be the culprit? That would be organic mercury. Remember that thalidomide is known to cause stunted or malformed limbs, not paralysis of limbs. And that concludes this section.